came to HOBY with a passion for learning and serving, and a determination to making a difference. HOBY gave my passion vision, helped me find a purpose, and continues to accompany me on my journey of service to humanity.
Over 2 years ago, I traveled to Thailand under a grant to study marginalized youth at risk along its border with Burma, one of many regions in the developing world where diarrhea and respiratory infections remain leading killers of young children. However, the Centers for Disease Control found that with proper sanitation and hand washing, such cases could be cut by 50%. I then founded So Others Are Protected, more simply referred to as SOAP, a self-empowerment initiative focused on some of the simpler issues surrounding sanitation and the spread of disease in Southeast Asia. SOAP functions on the donation of used, previously discarded soap from luxury hotels. Shards like these will be recycled through a process of cleaning, melting, and reshaping into new bars of soap to produce a sustainable source of sanitation in communities and for individuals where a deficiency exists. This process is conducted and controlled by locals. Quite simply, we reduce waste and save lives one bar of soap at a time. Since founding SOAP, I traveled to Uganda, where I volunteered in rural health clinics, ran triage stations, shadowed local physicians, conducted HIV/AIDS community outreach, and worked intensively with orphans and HIV-positive children. In 2014, I traveled to Haiti, where I joined a small team of dentists serving the slums of Port-au-Prince. There, I worked as a medical volunteer and EMT, conducting routine oral extractions and assisting in minor oral surgeries. This past summer, I traveled to India on a scholarship from the U.S. Department of State to study Hindi. Following a 6-week immersion in southern India, I joined a team of doctors working in the Himalayas for a 2-month fellowship as an EMT, serving populations only accessible via foot. There, studying the healthcare disparities, I further developed the SOAP model and was relied on as a translator between patient and doctor. In a matter of 2 months, over 4,000 patients were seen, treated, and educated.